to have the vaccination. Everyone in the BAME community, you need to do this to save lives, protect people. Let's do it.
It's the quickest way for us all as a society to come out of the circles of lockdowns. The only way we can all come out of lockdown is when we've all acquired some form of herd immunity. And there are two ways you can acquire this. Either everybody is exposed to the virus naturally, or we all get vaccinated.
Good morning.
Good morning.
Thank you very much.
Thank you.
Follow this barrier to my colleague, 1 second, just wait there.
Cool.
The vaccination is safe. It will protect you from catching the disease. It will prevent you from developing severe illness. So it does not only protect you, but also will protect others around you.
We have real-time data now that millions of people have been vaccinated with these vaccines and they have been safe. Now, the other thing is that this vaccine is not targeted towards people of ethnic minorities. It is targeted to all the populations.
There is no COVID vaccine for either black, white, or Asian community. It's the same COVID vaccine for everybody, whether it's a Pfizer vaccine, whether it's the AstraZeneca vaccine, it is the same for everybody.
The vaccination saves lives, it protects. So do yourself a lot of good. Take the vaccination, not only for yourself, but for all those who are close to you.
Can I take your name, please?
Matthew Ashimolowo.
And your appointment time is 10:50.
10:50, just about 4
Okay,
minutes
thank you
ago.
for coming today. If you'd like to follow my colleague,
Sure.
I'll show you through to get your appointment.
Thank
After
you.
testing positive, you would develop immunity, but we know with evidence that this immunity can only last for a few months, maybe 5-6 months. And so we've seen people that have tested positive, they are becoming reinfected. So even if you've had the disease, it's still advisable that you get the vaccination.
When you compare black men to white Caucasian men, black men have been shown to have been 3 times more likely to be diagnosed with COVID-19 virus. Then when you compare black women to white women, again, black women have been shown to be twice more likely to have COVID-19 infections.
Are you on any warfarin tablets?
What?
Warfarin tablets. It's a blood thinning medication. Warfarin.
No.
Okay, perfect. Just make your way. Great, thanks.
I haven't filled the form yet. You want me to
That's okay,
stick?
they'll fill it in inside.
Oh, okay.
If you'd like to make your way all the way round.
Since we have the opportunity of taking this, let's do it so we can protect the future, protect ourselves.
It's important for people from BAME background to be vaccinated because we know that people from this background are known to develop severe disease if they catch this virus. And it's also known that people from this background are likely to need hospital admission.
People from ethnic minority groups are more likely to be engaging people facing professions or careers or jobs. For example, in social care, auxiliary nursing, actual nursing, driving passengers, whether as bus drivers, they are more likely to be commuting in public transport, security guards, and so on and so forth, and working care homes and even going to people's homes.
When you take the vaccine, it protects you from having the COVID-19 infection. And if you do have the infection at all, it limits you being hospitalized or being taken to the intensive care unit.
Many people in our society have chronic health conditions such as hypertension, diabetes, and many other health-related issues that can affect the quality of life and can also affect you and make you to be vulnerable to the effect of the virus. Evidence, for example, shows that people who have diabetes, they are more likely to be prone to the virus. And when they catch the virus, also the virus take advantage of their immune system and then spread and occupy their lungs. And once the lungs have been destroyed, it is very difficult.
Vaccine today?
First what?
Is this your first vaccine today?
Yes, please.
Okay, that's your form. If you'd like to go through that entrance there.
Jeez, it's a lot of questions.
How's the busy in there? Yeah. We're okay at the moment? One moment, please. Right, through you come. Thank you, sir. How are you feeling?
I'm feeling good. I've had 15, I've done 15 COVID-19 tests because I'm always traveling. 15. Negative, 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 negative. But the vaccination is necessary. I'm going to be 69 this month. No matter how much I do to boost my immunity, I still am in the category of people who need to protect themselves. So if you're like my age range or even the lesser, protect yourself, protect your children, your grandchildren, protect the community. Let's get this thing going. All right? Thank you, sir.
Would you like to follow me?
Sure. Morning.
Right.
I haven't filled the form as yet.
Thank you. Can you tell me your name and your...
The medical drug licensing authorities in different countries in North America, in England here, and in Europe have been very alert to reports of side effects coming as people are getting vaccinated.
There are many of these vaccines because, as you know, we're in a global pandemic, so we need so many of them so that this can go all over the world. Yes, there are side effects for every medications, every vaccines, there are side effects. We've all been vaccinated as babies, we vaccinate our children, and we know that yes, you can have side effects from them, and it's similar to these COVID-19 vaccines as well. The side effects are usually mild and self-limiting. You can have fever, you can have chills, you can have pains, but most of these side effects clear within a short space of time.
You're well today, no temperature.
Very well.
And are you allergic to anything at all?
None that I know of.
No? Have you ever had a problem with a vaccine in the past?
Last one was when I was a baby, so.
Nothing. You haven't had the flu vaccine or any vaccine?
No, please.
Okay. And
Maybe polio when I was a little kid.
oh, okay. Yeah. So, but you didn't have any problems?
No.
And are you on anything to thin the blood, like warfarin?
No.
Don't take any medication, right?
No.
Have you had COVID in the last 4 weeks?
No, please.
Excellent. And are you driving today?
No, I'm being driven.
You're being driven. Lovely. Okay, that's always nice to have a chauffeur, isn't it? Okay, so you're having the AstraZeneca vaccine today. That's the Oxford vaccine.
Okay.
It's 2 doses, 12 weeks apart. You'll get called for your second dose.
Okay.
It's always possible to have an allergic reaction to a vaccine, but it really isn't likely.
What are the reactions?
So the most likely will be an achy arm from having an injection, or you might feel a little bit achy, maybe a slight headache, sometime in the next 48 hours.
Okay.
It shouldn't be anything more than a mild headache, and if you need to take some paracetamol, then please do. But it should all resolve on its own in 48 hours.
Okay.
Are you happy to go ahead?
I want to say that it's not compulsory that you take this vaccine, it's a choice. And what we are trying to do is to give you the information so that you can make an informed choice. But it's also good to know that your chances of being able to fight this infection or not to develop severe illness when you do contract this virus is by taking vaccines. But if you then decide that you don't want to take it, we want to say, please do not discourage other people because you might be putting them at significant risk of developing severe illness or in some sad cases, probably lose their life. So yes, if you don't want to take it because you feel, well, I'll be safe. If you feel you'll be safe, you don't want to take it, despite having all the information we've given, it's fine. But please do not discourage other people because you might put them at risk.
I'm ready.
Is there anything you'd like to ask me?
Nothing, let's do it.
No? And which arm would you like?
I thought it would have been better on my left arm.
Lovely. Okay.
I'm left-handed.
You're left-handed, are you?
Yeah, so I'll take it there.
Okay, that's entirely up to you. I'll just get the vaccine ready. Bear with me just a second.
Does it hurt?
So, if I say to you no, will you believe me?
I would believe.
In that case, no. It will be a bit of a scratch.
Because I'm a bit strange. I haven't had an injection. I've had one injection in 30 years.
Oh, right, okay. So no pressure then.
If I scream, make sure you cut that out of the video.
Absolutely, you'll ruin my reputation if you scream. All right, I'm just going to lift your sleeve up, okay? I want you just to let your arm hang. Drop your elbow back for me, just let it hang. Okay, ready? Scratch, sting, done.
It's done?
It's done.
So, that, just like that?
Just, I can. All right.
Oh, cool.
You feel okay?
I'm good. Thank you very much.
You're
Thank
most
you.
welcome.
So 12 weeks for the second one.
Cool.
Thank you very much. Thank you. Thank you. All right, let's go. Ladies and gentlemen, I've done it. I've taken the AstraZeneca Oxford vaccination. To think that such a simple thing could protect you would mean that it's very, very important. One more time, we cannot overemphasize the need for people in our community to come out and do this. Take the injection. Let's protect our world. Let's protect the coming generation. Let's get our community going, get the systems going, get the world going. So please do yourself a favor. Get your own COVID-19 vaccination as soon as possible. I really do hope this gets the community stirred up to begin to do something, all right? Thank you ever so much.
Thank you so much.
Thank you. All right, you too.